Yesterday, we explored the critical issue of maternal health, focusing on reducing the risk of stillborn babies. Due to a misrepresentation of data in our previous report, we revisit this important topic today to better understand the associated risks. The definition of stillbirth is a baby who is born after 22 weeks of gestation with a birth weight of at least 500 grams with no sign of life. We speak to Professor Dr. Imelda Balchin, an expert in obstetrics and gynecology from DSH2, to provide her insights on the matter.
In the last 10 years, we have more chronic diseases because of obesity. So more mothers are getting pregnant when they are obese and have problems with diabetes and high blood pressure like preeclampsia. So if they have uncontrolled diabetes and the babies are not doing so well, or if they have high blood pressure, so mothers have high blood pressure and preeclampsia, then doctors may have to intervene and say, look, we got to get this baby out earlier to save the baby or to save the mother or both. Then we'll have more interventions and more cesarean sections that has been rising to save these babies. So what we're planning to do, what we're trying to do, is preventing stillbirths or babies born without life, for example. And then you see the differences in the last 10 years. There may be a rise in numbers of low birth weight babies, but we are reducing the numbers of babies stillborn.
Dr. Imelda said this proves that awareness and early intervention helps in preventing stillbirths.
That is the reason why we look at mothers' risk factors from the beginning of the pregnancy. If you're at risk, it means you're mothers with high risk, then we have earlier referral to obstetrics and gynecology department from primary care, from clinic kesihatan, right? So that we do serial growth scans of the baby, we monitor the baby's health and growth, try our best to get the baby to mature gestation before they're born, but on some occasions, the babies are in trouble. The amniotic fluid, the fluid around the baby has dropped, the baby's not growing, and baby's moving very little or not moving at all is showing signs that this baby's health is deteriorating. Then we got to take action. We're going to say, look, let's get this baby out, and once the baby's out, we'll feed the baby and the baby will recover. But if we didn't, or we didn't even know there was a problem, that sometimes we get, it's too late, baby's already died inside the mother's womb. So that sometimes happens. And that's why we encourage all our mothers to monitor the baby's movements, pay attention to your baby, and come and see us in obstetrics and gynecology department, in the hospitals. If you think your baby's movements reduced and you're already in a third trimester,